Good morning, my name is Patrina and I'll be doing a head to toe assessment of Miss Edna. Good morning.
Good morning.
Can you state your name and your date of birth?
My name is Victoria.
Date of birth, please.
December 23, 1990.
Can you also tell me today's date?
August 3, 2020.
Okay, so she's alert, she's oriented, and next I'm going to go on to do a head and neck exam. First I'm going to look and note the skin. I'm going to palpate the head. It's normocephalic, there's no lesions, no masses felt. Next I'm going to move on, I'm going to palpate her temporal artery. I'm also going to check the temporal mandibular joint. Can you open and close your mouth? Can you move it from side to side? Okay, and it's intact. Next, I'm going to have you remove your mask because I have to assess cranial nerve 5 and 7. Can you raise your eyebrows? Can you frown? Smile? Puff your cheeks? Okay, I'm just going to touch your face lightly and you're going to tell me, close your eyes, and then you're going to tell me if it's a sharp or dull sensation that you feel. So,
Sharp. Dull.
thank you. Next, I'm going to assess your skin. I'm going to have you lift your neck, turn it to the left. Good. And I'm looking at the skin at the same time for discoloration. There's no discolorations, no lesions. At this point, I would have you drink a sip of water because I'm checking your trachea to see if it's midline. I will skip that section, but the trachea is midline. There's no problem. If there was a problem, then I would auscultate for bruits, and there's no bruits. Are you doing okay?
Yes.
Okay, thank you. And next, I'm going to palpate your thyroid. So you're going to tilt your head to the side so I can, and it's not palpable, which is normal. Next, I'm going to check the range of motion of your head. Can you tilt your head backward, forward? Can you tilt your head to the left, to the right? Can you use your left ear to touch your left shoulder? Left ear to touch your left shoulder. And then you're going to do the same thing on the other side, your right ear to touch your right shoulder. And the range of motion of your cervical spine is intact. It's very good. You can open your eyes for now. Next, I'm going to palpate your lymph node. First, I'm going to palpate your pre-auricular lymph, then your post-auricular, then I'm going to move to the occipital lymph, then I'm going to check the tonsillar, then I'm going to do the submandibular, I'm going to do the submental, then I'm going to do the superficial cervical, then the posterior cervical. I'm also going to do the deep cervical, and then the subclavicular lymph. And none of your lymph nodes are palpable, which is normal. And we're going to move on to check cranial nerve 8. We're going to examine your ear. At this point, I'm looking at your ear. I'm checking the auricle and the lobule. I would check the mustard process at this point and palpating. Is there any pain?
No.
No pain, which is normal. I would use my otoscope to look inside the ear, and what I look for is I'm looking at the tympanic membrane. I'm looking if there's massive or any excess cerumen. So now I'm going to do the whisper test. And with the whisper test, what I'm checking for is I'm checking for the ear conduction. So I'm going to place this in the center at the top of your head, and you're going to tell me if you can feel the vibration and hear the sound.
I hear the sound
Okay.
No vibration.
Okay. So if it's abnormal, I would just have her follow up with the ENT specialist. So next we're gonna move on to the eye. Next we're gonna move on to the eye exam. The eye exam. Next we're gonna move on. You doing okay? Everything's alright. You're sleepy. Alright. So at this point, I would check your visual acuity. I would use a Snellen chart, and you would stand 20 feet away, and then you would read the lowest line with your eyes covered, and you will do that with the cover in the left eye and then next cover in the right eye. So now I'm going to check cranial nerves 2, 3, 4, and 6 at this point. So I'm going to check the peripheral fields. I'm going to have you use your right hand to cover your right eye, and then I'm going to do the same. I'm going to move my fingers, and then you're going to tell me when you can see my fingers. Can you see it?
Mm-hmm.
Can you see it?
Mm-hmm.
No. See it? No?
Mm-hmm.
And check this side. Can you see it?
Mm-hmm.
Can you see it?
Mm-hmm.
Okay, so the peripheral fields is intact. Next, I'm going to shine the light in your eyes, and what I'm looking for really is for symmetry. It's a little bright in here, so it's not as efficient as it should be. I'm checking. At this point, I'd put my gloves on, and I would pull the eyelid down, and I would check to see if the sclera is white, if there's drainage. From what I'm looking at, it looks normal at this point. There's no nystagmus noted with the eyes. Doing okay? Alright, so next I'm going, I inspect the eyes, I inspect your eyebrows, your eyelids, and everything looks alright. So there's no conjunctiva noted, sclera is white. I'm going to check for Perla. I'm going to have you follow the light. Do not move your head, just your eyes. So okay, and then she has Perla. The pupils are equal, round, and reactive to light and accommodation. I'm now going to check your mouth and throat and have you open your mouth. Okay, and if she opened her mouth, I would just look inside to see if the uvula is midline, if there's any lesions in her mouth. So she will open her mouth. So I'm gonna close your eyes, and I'm gonna check your cranial nerve 1. So I'm gonna put a scent in front of you, and you're gonna tell me what you smell.
Lemon.
Lemon, and it is a pack of lemon that I had for her to smell. So next, I'm going to just put my hands on your shoulder and have you shrug your shoulders. Just shrug your shoulders against resistance. And she was able to shrug her shoulders against resistance. Can you stick your tongue out? Okay, good. And I'm gonna have you push your tongue to the side, and I'm just checking for the strength to the other side, and I'm just checking for the strength. Now I'm gonna palpate your sinuses. So I'm palpating your frontal sinus, any pain or tenderness, and I'm also gonna palpate the maxillary sinuses, any pain or tenderness, and there's no pain or tenderness, which is normal. So next I'm going to move on to do the respiratory exam. And I would assess you from the back, and she's not going to take her shirt off, but what I would make certain that there's no curvature and no lesions, no masses from it. I would also move down and ask her to say 99.
99.
99.
99.
And then so the AP diameter is less than the transverse diameter. I'm gonna ask you to take a deep breath, and then I'm gonna auscultate. Deep breath in Deep breath in. Deep breath in. Deep breath. Deep breath. Deep breath. And her lungs are clear. I would also percuss at this point, and what I'm percussing to see if it's resonant throughout her lung fields. And I would do the same thing to the front. I would listen to her lung sounds from the front. Deep breath. Deep breath. Deep breath. Deep breath. And her lung fields are clear. Next, I'll move on to do an abdominal exam. I won't have her lift her scrubs, but I would inspect, and what I'm looking for is for the pulsation. I'm checking if there's skin discoloration, if there's any masses, and I would describe her abdomen as round or flat. And then I would start auscultating, and I would start in the right lower quadrant, then the left upper, then the right upper quadrant, then I move over to the left upper quadrant and the left lower quadrant. I would also, and then she has normal active bowel sounds, and I would percuss and do deep palpation of the abdomen, and I'm feeling for any tenderness, any enlarged organ. I'll feel the right upper quadrant if her liver is enlarged, or the left upper quadrant. I'd feel if the spleen is enlarged and there's no enlarged organs in her abdomen. Next, I'd move on to do the cardiac exam, and I'm looking at her chest for the rise. I'm checking if the breathing is effortless, and they're effortless. So I'm going to go ahead and auscultate. I'm going to auscultate the aortic artery. Then I'm going to move on to the pulmonic, which is in the left second intercostal space. Then I move to the Erb's point. Then the tricuspid, which is in the fourth left intercostal space. Then the mitral, which is in the left fifth intercostal space. And I will listen at the maximal point, and she has regular heartbeat, no murmurs, no S3 or S4 is heard. So next, I'm going to have her stand with her, can you stand? Your feet together and your arms. I'm going to do the Romberg test. I have her close her eyes and see if she can stand straight for maybe like 20 seconds. And she's able to do that. At the same time, I'm looking for symmetry. I'm checking her skin. I'm checking her skin turgor for tenting. There's no tenting. She's hydrated. I'm checking capillary fill, and that was less than 2 seconds. So they're okay while I'm here. I'm going to palpate her brachial pulse and her radial pulse, and they're within normal. You can sit and sit now. You can sit. You can sit. Then I will do the popliteal and go down to her feet and check her pulses, and I'm checking for swelling of the extremities, and there's no swelling, no pain. There are 2+. So next I will assess her joints. I'm going to assess for range of motion, if she can do abduction, flexion, and she's able to do all that. Her range of motion is intact, no joint pain, no swelling. So everything is okay with her. Do you have any questions for me? Thank you so much for cooperating in my head to toe assessment.
You're welcome.